Strictly Come Dying. In the UK, Strictly Come Dancing is a very popular TV series that has revived interest in ballroom dancing, spawning similar TV programmes in many countries. In medieval times, there was a concept of the Danse Macabre, or Dance of Death, and there were many paintings and books describing the last phase of life as performing a final dance. This allowed people to consider and possibly plan and prepare for their final days. When explaining how people actually die to medical students or indeed to members of the public, we sometimes ask, if you had to die, what would you choose to die of? Usual replies are an accident, or a sudden heart attack, or a fatal stroke. But then we explain that dying of sudden events is now rare. The common causes of dying are either progressive cancer, or when a person's lungs, heart, kidneys or liver gradually stop working, or thirdly, increasing frailty in older age. And now, in fact, in the last 10 years, more people are dying experiencing a number of illnesses at the same time. Then, to illustrate that the experiences of declining health and dying can be very different for these four trajectories, we compare the more rapid death of some types of cancer to dancing a Scottish eightsome reel. There's a clear beginning, it's usually fast and furious, usually predictable and with a clear end. And in Scotland most people know the steps. So then what type of dance might represent people dying from a poorly functioning heart, liver, kidneys or lungs? A tango, with its intermittent movements up and down representing the acute episodes in this sort of illness and its tricky, irregular steps. Few people in Scotland know how to do this dance, just as there's little public understanding of becoming more unwell this way. Then we ask, what dance might you perform if dying with frailty or dementia? And the last waltz, it's slower, may take longer, and you hope to be in the arms of someone close to you, although they may have already died. Then finally, we note that people dying with several illnesses might have experiences like dancing in a disco with a variety of fast and loud music, like the 17th song Staying Alive, and then slower tracks, all with different steps. So this illustrates that dying can be very different for different illnesses, in tempo, movements, duration and complexities. See, the point is that just as knowing the music and steps helps us dance well, understanding the typical sequences of physical, emotional and spiritual experiences will help us navigate dying for ourselves and for those we care for. So let's learn how people may experience the last phase of life so that we can be better prepared for dying when it comes and make the best of it. Let's have a new TV programme, Strictly Come Dying. We can show people learning to live and die well. Let's bring death back to life and let's learn some steps so we can plan ahead and talk more confidently about declining health. Then we can bow out in style.